There are many different types of brain tumors. My understanding is this patient has an oligoastrocytoma, which is a combination of two cells, an oligodendrocyte in the brain, which is a support cell in the brain, and a glial cell, which is another different type of support cell in the brain. So for this patient, he has a grade 2 malignancy, is my understanding. Grade 1 malignancies are pretty much normal brain tissue. The grade 3 malignancies are highly malignant, highly aggressive. The cells are dividing rapidly. And a grade 2 tumor then is in between. The treatment for children and adults with brain tumor is surgery. The neurosurgeon will evaluate the MRI scans prior to surgery, will plot out where the critical areas of the brain is before surgery so that he can avoid them, and then he'll go in and remove as much of the tumor as he can on the first take. Often the patients have a tumor the size of a walnut or an egg at presentation. We're always amazed at how big they are. The brain tolerates that swelling until it reaches a point where there's some sort of critical progressive event that occurs. Any patient with a grade 2 brain tumor is not good. It'll be remarkably stressful on the family and on the patient. The costs will be $100,000 to $200,000 a year, and then additional costs for transportation to and from the medical center. There's costs for loss of income for employment that people aren't able to go to work. There's costs for out-of-pocket expenses of feeding the patient and the family and housing the family when they're not at home. Everyone does as much as they can to help the child with a brain tumor. It's a tremendous challenge, and often the patients will do well. The family initially gets tremendous support from the community, but this process is a 2 or 3 year process, and often families are embarrassed to ask how a child is doing, and they don't know how to interact with someone who has a child with cancer. Cancer is not contagious. The family needs tremendous help socially and emotionally with this difficult thing. So it's important to not forget about the child or the family 6 months, a year or so after this. It's a big fight. It's a long fight.